There actually are multiple types of diabetes. There's a type 1 diabetes, and this condition is what we call an autoimmune. Basically, your body's kind of fighting itself. And one thing that fights is the pancreas, because the pancreas makes the insulin. And remember, insulin is that key that helps you use the glucose in a proper manner. So what happens with type 1 diabetes, for some reason, your body fights the cells that make this insulin. And when it does so, then of course you don't have it around to help you to regulate your blood sugar. Okay. Diabetes type 1, we typically think of as children and younger adults. It can appear at any age, but for the most part, children and young adults is when it really kind of manifests itself. So people that get diagnosed with type 1 diabetes have to take insulin. They do not have the option of taking, certain types of pills and stuff, and we'll talk about that a little later on. But type 1 diabetics, they're kind of the one mark about this is that they have to take insulin every day. If they do not, they can get extremely ill. They actually can die if they don't take their insulin. So that's what the type 1 diabetic is. Then we have type 2 diabetes. And type 2 diabetes actually is the most common type of diabetes. And type 2 diabetes, your body actually makes insulin, but what happens is that there's the insulin's floating around, but your body it just can't respond to it for various reasons. It just doesn't respond to the insulin that your body is producing. So when that happens, that blood sugar also kind of just floats around. It's high levels. And of course, it does the damage to the blood vessels and organs, kind of like the other type of diabetes. So remember, type 1, you do not make insulin. Type 2, you make insulin, but you don't respond to it. Type 2 diabetes is a lot of times linked with excess weight, inactivity, family history, and age. But it can occur in younger people as well. As a matter of fact, it's starting to occur in younger people as well, which is a little unusual. But one of the things that noting is that a lot of times this is typically related to also weight. Obesity increases in young people. Type 2 diabetes increases in young people. Then we have a gestational diabetes, and this is for the ladies out here. So this is a diabetes that occurs during pregnancy in someone who did not have diabetes before. So this is someone that does not have diabetes. They get pregnant. As part of screening, they're found to have developed diabetes. Now, the important thing about this is that it increases the risk for both the mother and the baby and raises the mother's risk of developing type 2 diabetes later in life. So this is for the ladies. If you were pregnant and you get diagnosed with gestational diabetes and maybe resolved after the baby's delivered, it is important to keep screening because you are at risk of developing type 2 diabetes later in life. Okay.